We have one of the most complicated healthcare systems in the entire world by far. We've been brainwashed to think that that's the only way. I had been practicing military medicine. So I spent about 3 years in the civilian sector as an assembly line doctor, basically working in a system where the appointments became shorter and shorter. We had more and more administrative requirements that didn't add value for the patient, and I was becoming progressively tired and frustrated. And all of this was somewhat expected. At the end of the day, what I care most about is the relationship with the patient and helping partner with them in a meaningful way, meaning giving them the right care at the right time by the right person, which is someone who knows them like myself or my colleagues. So in many ways, it's a throwback to the way medicine used to be, which is if you speak with people who are old enough, they'll remember the times when they knew their doctor, their neighborhood doctor, person that they could reach out to in time of need, that knew who they were, that could guide them, even if that meant after hours, even if that meant coming to their home. We have one of the most complicated healthcare systems in the entire world by far. No other country is even close to how unnecessarily complex our system is. So we're removing all of those layers and restoring the doctor and the patient, and that's the starting point. What most people do when they go into their doctor's office in the insurance-driven system is they're asked, what insurance do you have? Why is that the first question? And why does that dictate so much of what happens, whether something is very complex or something is very simple? We've been brainwashed to think that that's the only way. The reality is that when you peel away the non-value added layers, you can have same and next day appointments, you can have 30 to 60 minutes on average as needed. You can do after hours care. You can do a lot of telemedicine, remote communications. You don't have to ask people to take a half a day off of work, come sit in a waiting room full of sick people for 8 to 10 minutes face to face. So we're really, in a way, we're reimagining how the care is delivered. We're doing it with transparent monthly pricing, which should be affordable for the majority of people. I'm Dr. Skochko, and I'm a direct primary care physician.